Is that you are talking with a 3-year-old boy, Jisan mother. She is Mrs. Mary. Okay. Mary has
Okay.
last 6 months recurrent cough, and some with cough there is some sound present.
Okay.
Do you want time?
Name of the baby, Jisan. Mom is Mary.
Yes, 3-year
Mother
old
is,
he is.
yes. Yes. Okay. Can I start?
Yes, you can start.
Okay. Okay. Hello. Good morning.
Good morning.
I'm
Good
Dr.
morning.
Ruxana, one of team member who is looking. One of the team. Yes, I'm Dr. Ruxana, one of the team who is looking after Jisan. Am I speaking to Mary, mom of Jisan?
Yes, I'm married. Jisan is my child, my son.
Yes, thank you, Mary, for coming here. I believe that Mary. Yeah, I believe that Jisan has some problem that is cough with some sound. Can you please describe it for me?
Yeah, doctor, what I said that Jisan is suffering last 6 months cough off, on and off cough, and sometimes there is some noisy breathing. Also, I'm finding that is my concern.
Oh, I'm so sorry to hear about this. So, for last 6 months, is it developed? Does it change over the period of the time? That means it is worsening day by day, or it remains the same?
Sometime it worsen, but I think it remains same. You can say.
Okay. So, do you notice any seasonal variation or any specific period when this increases?
Yeah, what I say, I have noticed one thing that sometimes he has developed some cough. I think after that, that is happened, some low grade fever type. Then he suffered this.
I see. And what is the type of the cough? Is it making any productive cough or the dry cough?
It is a dry cough.
Dry cough. Okay. And anything making this cough better? Do you notice?
Better, actually, he has inhaler. So if he takes
Yes.
the inhaler, then it becomes, I think, improve.
Okay. And anything that makes the condition worse, the coughing worse?
Which means I told you once that
Yeah, yeah,
he have
yeah, yeah.
developed some low grade fever, and then he developed this. Always I feel that.
Okay, okay. And how many does Jisan develop any kind of nighttime symptoms?
No symptoms, not symptoms. I think daytime all over the day.
Okay, and is the cough is associated any kind of breathing difficulty?
Not that much severe, not breathing difficulty develop, but he's coughing. That is
Okay, okay. Any
some
blue
noisy.
coloration? Okay, any blue
Mm.
coloration of the whole body?
No, never he done blue, never gone blue.
Okay, so Mary, does nowadays Jisan has fever?
Yeah, just few days, 3 days back, he has low grade fever. I feel that. Then I have given some paracetamol
Mhm.
syrup. It settled down.
Okay, that's great. And what's about his appetite? Do you have any concern?
His appetite is good. I have no any concern.
Nice to hear. And does this activity hampers his? Does this illness hampers his sleep?
Not sleep, not hampering.
Mhm. Any hampering of his daily activity?
No, he's really a runny boy. But sometimes if
Yeah,
it
yeah.
is much more worse, then it create problem. Otherwise, no.
Okay. So, Mary, I'm now going to ask you some question of different system of Jason bodies to make sure that these are not present. So, does he had any kind of fits?
No, never he fit occur.
Okay. So, Mary, do you feel he has any kind of awareness of the heartbeat?
Yeah, if too much coughing, then sometime I think heartbeat race.
Okay. Any kind of skin lesion, itchy skin lesion does he has?
Some he has some eczema problems. For that reason, skin doctor given him some emollient.
Okay. And what's about does he has any kind of itching nose, um,
Yeah,
nose?
yeah. That this I want to say that sometimes he has some runny nose, this low grade
Yeah.
fever develop, and after that he has this problem occur.
Okay. So do you have any concern regarding his pee and poo?
No, I have no any concern about pee and poo.
Okay. So now I'm going to ask you some illness of his previous illness. Does he has any kind of chronic illness?
No, he has no any chronic illness. Just he's that is the
Mhm.
problem. He has cough
I
problem.
see. Yeah. Okay. And does he need any kind of hospitalization before?
When he was in 2 years of age, then he has admitted for bronchiolitis.
I see. And how long he was admitted?
So just one day, maybe the next day, the doctor discharge with some treatment.
Okay. You are telling that he has this kinds of illness for 6 months. So what do you do for his this illness?
Yeah, we go. Doctors give some syrup. He's taken, and I
Mm-hmm.
already told you that one
Yes.
blue inhaler he's take. That is, and we
Okay.
give hot water, warm
Yes. Yes.
water.
Okay, that's nice. And uh, who taught you about the technique of the inhaler?
Yeah, I have said with the nurse. The nurse
Yeah, yeah.
teach me the technique of this.
Okay. And how about Jisan compliance of this inhaler? Does he agree to take it?
Yeah, he's really naughty boy, but I'm giving him,
Mhm. Oh,
trying
I
to
must
make it regular.
appreciate. Yes, I must appreciate your effort. So let's go to the period when Jisan was in your tummy. Do you have any concern regarding your pregnancy period with Jisan?
No, it was normal, very much smooth. I have no any concern.
And after birth, does he undergo all kinds of screening test?
Yeah, doctor done everything. I don't find
Okay.
anything. Doctor told me anything.
Okay, that's nice. And yeah, do you have any concern regarding this Jason's development?
No, he's developing
Mm. Mhm.
nicely, talking, running, everything.
Oh, that's great. And Mary, do you feel does he has any allergy to any specific food or medication?
Not medications, food. I think sometimes he has some strawberry allergy. I think some itchiness develop. So
Okay.
I'm not giving him strawberry.
Mm. Does Jason receive all kinds of his jabs?
Yeah, he's taken all the jabs.
Okay. So, Mrs. Mary, can you please describe? Do you have any concern regarding his growth?
No, I have no any concern.
Okay. So, Mrs. Mary, do you please describe your family for me?
Yeah, me, my husband, Jisan, and I have
Mhm.
another child. She's Natalia. Natalia is 7 years old. She has also this problem, but she grown up. It go away.
Any is okay. And are your partner and you are blood related?
No, we are not blood related.
Okay. And what do you do for your living?
Yeah, I'm a teacher, and my
Oh,
husband is
okay.
an engineer.
Okay. And so you are working both together outside. So who look after Jason when you are outside the home?
Yeah, sometime we go her in care home. They go.
Mm-hmm. And does she know? Does they know about? Do they know about how to give this inhaler?
No inhaler. Yes, I have given them the inhaler. They know.
Okay, okay,
Nine
that's
minutes.
great. Okay, do you have any concern? Do you think that it may be a personal question, but it's a routine question that are your income is satisfactory for your living?
Yeah, it is satisfactory. I have no any problem.
Okay, so does Jisan is 3 years old. Are you planning for schooling?
Yeah, you are planning for schooling.
Okay. And can you describe your home for me?
Yeah, it's a routine home, nothing special. We have a three bedrooms house.
Yeah.
That's all. One is guest room, one is our bedroom, another our child room.
Okay. Does is it is well ventilated?
Yes, it is well ventilated.
Do you have any kind of pet?
We have not pet actually, but
Hmm.
our neighbor has pet. Why? They have bring a pet, and my child is so interested about this pet.
Okay. Okay. And does Jisan has go to their home or look after the pet
Yes, yes, he's
randomly?
very fond of. Yes, yes, he's very fond of this pet. Why?
Okay.
Why you are asking this?
Yes, yes. I'm asking that we're suspecting that there may be he has some problem which may this condition may can increase this coughing. That's what as a routine question we are asking.
Oh,
Is it okay?
okay.
Okay. And what is the impact of Jesus this condition in your life?
Yeah, I'm really worried about that. Suffering last 6 months, and also we are want to start the nursery, and how we'll coping with this nursery. I'm really tensed.
Okay, we will raise this issue after taking the history and examination of Jason. So, what do you think? Why, mom? Do you have Mary? Do you have any idea why this kind of attack occurs repeatedly? We
I don't have
with
any
yes.
idea. I don't understand actually. I'm here for that reasons. Why this
Uh,
is happening? Is there anything we make wrong with this?
okay, we will go throughout it. And Mrs. Mary, do you want any tell anything that we have not discussed yet?
No, I have no any concern.
Okay, so thank you, Mrs. Mary. You have shared a lot of information with me. I will go make team and discuss with that, and I will come back immediately after discussion. Thank you for your valuable time.
Just 1 minute before you complete your history. Now, please describe your history.
Yes, today I have take history from Jason's mom Mary. Jason is 3 years old with history of repeated cough with musical sound for last 6 months. He has atopic march in the form of allergic rhinitis and eczema, and there is this cough is associated with wheezing, and one hospitalization history is present diagnosed with bronchiolitis. Family, her sister has similar type of condition, and this condition is improved with blue inhaler. And there is a neighbor pet, and often Jisan meet with this pet, and mom is very much worried regarding his starting new journey to the nursery. What will happen in this issue? Mom is concerned.
Okay. So, what's your diagnosis and differential diagnosis?
My professional diagnosis is a case of asthma, bronchial asthma, and
And you?
I have some differential diagnosis. It may be viral induced wheeze and cystic fibrosis, and uh, uh, recurrent aspiration following H-trap tracheoesophageal fistula, and it may be chronic wheeze following previous whooping cough or pertussis like illness. Maybe there is no history of choking, but it may be due to foreign body inhalation.
Okay. So, you have given us lots of differential diagnosis. For tracheoesophageal fistula, do you ask any question?
No, I don't ask about the choking or any kind of.
Vomiting, you
No,
have
I
not
don't.
asked.
Vomiting, yes, yes, vomiting. I don't ask. Yeah,
Gastroesophageal reflux disease is one of the DD we can keep.
yes, yes,
Okay.
yes,
Suppose that is a viral induced wheeze. Okay. How can you
yes.
differentiate viral induced wheeze and bronchial asthma?
Yes, in case of viral induced wheeze, usually it occurs less than 2 years of age, and between the attack, the child will remain symptoms free. and after onset of any kind of viral illness, it exaggerate the cough. Whereas in case of bronchial asthma, any triggering point, following this triggering point, there will be the cough with musical sound, and family history is present in case of bronchial asthma.
Okay. In the history, do you ask that in between the attack he has symptom free or symptom not free?
Yes, I probably, I'm not sure, but probably I asked to differentiate during
No,
the
no. Yeah.
analysis. I'm not sure.
Okay, you have missed this point. Okay.
Maybe, yes, yes.
Okay. So that is. Can you please tell me what are the differential diagnosis of wheezes? Some causes of wheezes.
Yes, some causes of wheezes is viral induced wheeze, early asthma, cystic fibrosis, bronchiolitis obliterans following the whooping cough, pertussis, foreign body inhalation. Yes,
Okay. So what examination you want to do? How can you manage this patient? Tell me.
yes. After taking this full history, I want to do the general examination, anthropometric, vital sign, and chest examination,
Hmm.
and
Then
want to do some investigation.
tell me.
Yes, the investigation, routine investigation is full blood count with with eosinophil count, and to establish the diagnosis, the provisional diagnosis asthma, reversibility test. Um, uh, yes, reversibility test and trial of as is 3 years also trial of bronchodilator may be done, and to exclude other differential diagnosis, sweat chloride test for cystic fibrosis and bronchoscopy for foreign body, and pH monitoring for gastroesophageal reflux disease.
Okay. Suppose it is a viral induced wheeze. What
Yes.
investigation you do?
Uh, in case of viral induced wheeze, usually no investigation is needed. It's a clinical diagnosis.
Okay. So anytime you can do any investigations. If suppose it is a life-threatening condition.
Yes, life threatening condition. So I will do the ABG, air arterial blood gas analysis.
Okay. So your first top diagnosis was bronchial asthma, right?
Yes, yes,
So what is the degree of bronchial asthma here? Mild, moderate, severe?
yes, yes, mild, moderate, and severe.
So what is your patient? It is severe bronchial
Okay,
asthma
yes,
or
yes,
mild and moderate?
it is mild, moderate, mild to moderate, severe, moderate bronchial asthma. As
What question you ask to know that is a
yes,
mild to moderate?
yes, can he speak a full sentence?
You ask
And
this. Can he complete the sentence? And do you ask this line?
no, 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 I don't ask. I don't ask.
Okay. Suppose it is a viral induced wheeze. What is the treatment
Yes.
you give?
In case of viral induced wheeze, first of all, prevention, and also if there is, will give the bronchodilator, and Montelukast may be given. And sometimes steroid after oral steroid prednisolone can be given.
Okay. And do you have given any advice to mother?
Yes, yes. Advice for the avoidance of the passive smoking,
Hmm.
and any figure or triggering fever, removal of the pet, increase the ventilation, decrease the dust.
Okay. So if the viral induced wheeze, how can we know that it is going to be developed asthma? What are the criteria will be present?
There will be some major criteria and some minor criteria. Major criteria is there is family history of asthma, and skin test is positive, and doctor is diagnosed allergic dermatitis, that is eczema. This is the major criteria, one major
Hmm.
criteria or two minor criteria for the diagnosed asthma predictive value. And minor criteria is blood eosinophil more than 4%, and allergic rhinitis is diagnosed.
Okay. And in a discharge treatment, do you do anything?
In the discharge for this patient bronchial asthma.
Hmm.
Yes, I first of all, as less than 5 years, so I will give moderate dose in steroid for 2 months, 8 weeks, and then I will review the child. If the condition is improved, so I will go for the low dose inhaled corticosteroid with a short acting bronchodilator, uh, and I will review after 4 to 6 weeks, 4 to 8 weeks. If the condition not improve, I can start LTRA with SAVA.
Okay. So do you give spacer discharge?
Yes, yes, bronchodilator with spacer. Yes,
Suppose the child has life-threatening conditions. You refer which doctor, which specialist?
I will doctor for respiratory physician.
Okay. I think we cover everything.
Okay.
So thank you
Thank
for
you.
your participation. Your
Yes.
history, okay, you reach. Actually, our top diagnosis here is viral induced wheeze.
Okay, okay.
Some question you miss, like onset course and duration, what make it better, what make it worse? Is it recurrent? Is he normal in between the attack? That is the question that is suffering viral induced wheeze and asthma. Is the sound is still to be heard after being well? Okay, is he turned blue? Is it
Mhm.
more at night? Same all over the day. You ask that. Is it more at night? Describe me his cough. You ask that is a dry cough. I told musical sound. Can he complete sentence? Very important because mild, moderate, severe. We knew that. Does he lose anytime consciousness? Anyone tested his oxygen saturation level? Okay. And you go, but you don't ask MSK, CNS, severe GIT, vomiting. You need to ask.
Okay,
MSK, you have not asked any hyper or hyperpigment area about the neck and axilla. Very important. Addison's disease also searching because his case. So Addison disease can be associated with that. Past
okay,
history you ask nicely. Inhaler technique you ask. Who given inhaler it is nicely. How everything you ask. Allergy history you need to take details. I just tell you strawberry history. So you need to that anytime admission needed previously in hospital for allergy or any medication he's taking or not. Okay, ask
okay.
about other allergies in details. So you just know and go. And in presentation, you note to mention that he has strawberry allergy.
Yes, I forgot. Yes, yes, I forgot.
Family history you asked, but any similar condition in the family you have not asked. Though in presentation and answering,
Mhm.
you told me. And another thing, you pets asked, but smoking. Anyone smoke in the home?
Yes, I
What about
forgot.
your
Yes,
floors? Are they
yes,
laminated
yes.
the floor? How is your hold? Old house or new house? It's 3 years age old. Lead
Okay,
pipe sometime in old house. Aeration you ask about the bed sheet and carpet. To which degree they wash it? Is there any garden? This is very
okay,
important.
okay.
Otherwise, you cover. You are structural in this history. You nicely answer everything. You answer very nicely the viral induced wheeze and asthma trigger differentiation. You tell it. Prime DD of wheeze also you tell nicely. Management also you tell. Management is yes, that is fast viral induced wheeze. Actually, we don't need any investigations. Either life threatening, then we'll do the chest X-ray, pulmonary function test, ABG, urea electrolyte, and random blood glucose. And
Oh,
examination will do the ABC, vital oxygen saturation, cyanosis, alert or not, can he complete sentences, and chest examinations. Okay. And treatment, yes, you tell nicely that is salbutamol. I will give him inhaler first, then steroid tablet prednisolone. Duration is 2 to 3 days. Usually settle down for the inflammation of chest and Montelukast we are giving.
yeah.
Most children of the viral induced who need a regular preventive inhaler. Otherwise, you tell nicely everything. Okay, just 2 or 3 things. The family history you need to put four or
Yes.
three, 4 lines and the present illness. Okay. Next, you